Hi, everybody. This is Swag. And tonight I would like to discuss a topic that may not be as easy to talk about, and that is the increase of sexually transmitted infections amongst senior citizens. So that would include our mothers, our fathers, our grandparents, and our uncles, our aunts, great uncles, and great aunts in most cases. The reason that this topic has come up is because there has been an increase in the amount of STIs amongst senior citizens. When we hear STI or STD, however you want to refer to it, we think about teenagers in high school, we think about young adults, and we very, very rarely or never think about grandma or grandpa. Since there is an increase in these infections is because older people tend to underestimate their risk. And so they don't take precautions such as using condoms or testing for STIs prior to engaging in sex with a new partner. And then, of course, the women, they don't worry about pregnancy, so they're likely to, not enforce condom usage. And with the increase of, the way we have all of these different medications and resources, such as erectile dysfunction drugs, that helps more older men remain sexually active. And we have hormone therapy that helps older women remain sexually active. And so a larger number of older adults tend to live within facilities such as assisted living, senior citizen buildings where they have their own apartments. And one thing that we uh, don't realize is that older people aren't giving STI education. And in most cases, they have not heard anything about STI education for many decades. And when you put all of that together, you see a population where there's probably a little more risky behavior going on. And we have a lot of times where older people have lost a mate due to divorce or death. And so they may date and they may see multiple people and they just don't consider protection. So a lot of times when they go to the doctor, like they may go to the physician, and in most cases, a lot of senior citizens do go to the doctor more than younger individuals. However, there are no screening guidelines for STIs in older adults. When a younger individual goes, the doctor automatically considers, you know, have you been promiscuous? How many sexual partners have you had? And so screening for chlamydia and gonorrhea is recommended for sexually active women and older women with risk factors such as multiple sex partners. Um, but and then sometimes even for men who are same sex individuals, of course they automatically say, okay, well, we're going to test you for an STI. So a lot of times these STIs can be easy to miss in older adults. One of the reasons is because symptoms may be overlooked, and sometimes those symptoms are mistaken for something else. Some STIs, particularly chlamydia, may be asymptomatic, meaning that there may not be any symptoms for it. So detection can be especially challenging when these symptoms mimic other um, illnesses or other problems for that older age individuals suffer. Gonorrhea, for example, can cause arthritis-like symptoms. So they may feel like, oh, I just have the old Uncle Arthur, I have arthritis, so they wouldn't check for gonorrhea, whereas they might for a younger person. HIV can cause weakness and fatigue, so that wouldn't be abnormal either. Syphilis is known as the great imitator because it can look like pretty much anything, according to Dr. Gangstad, who says that that's what makes it a tough diagnosis. If you don't go looking for it, you won't find it. So that is that's like a geriatric physician who um, has seen an increase of patients with STIs. So, because symptoms can be missed in older adults, they are less likely to be diagnosed soon enough. One of the things that is recommended is that senior citizens get screened for STIs before engaging in sex with a new partner, and that they keep their doctors informed about any new partners, and most of all, not to be afraid to talk with their doctor about risk factors. I know, like I said, a lot of people were like, "Oh, I'm not going to talk to my grandma about that or my grandfather." But if they're out and about, if they're living independently and they get around well, and a lot of us know grandpa or uncle or whoever, well, you can tell they're a little frisky, right? So it's important to just keep that in mind. Um, and maybe even have that conversation. A lot of times, I would think that males can kind of talk to males more comfortably. Women, we're kind of like secretive, or we may not be as open to talking about that. So please leave your comments in the comment section. Like, tell me what you think about this. Is this something that you would feel comfortable talking with your grandparents or your parents or your aunt and uncles about? And yeah, so leave me some comments, and also leave me comments about things that you would like to discuss, that you would like to talk about. And check on your people, check on your grandma and your grandfather, okay? So until next time, I will talk with you later. I must, I can, I will.
To address this growing concern, it is crucial to raise awareness about sexual health among older adults. Healthcare professionals should prioritize discussing safe sex practices and offering routine STI screenings for all age groups. This will ensure that senior citizens receive the information and care they need to maintain a healthy and fulfilling sex life while protecting their overall well-being.